Hello, welcome to exercising after head and neck cancer surgery. I'm Janet West. I'm delighted to say we're going to share lots of different exercises with you, some advice on how to cope with your up days and down days. We're going to look at posture and we're going to look at nutrition. In April 2019, I was diagnosed with stage 2 aggressive cancer of the tongue. A tumour the size of this grape grew at the back of my tongue. It hurt to swallow, it hurt to cough, it hurt to sneeze. It was awful. However, Churchill Hospital helped me. After an 11-hour operation, I am cancer-free. So, join me looking at exercises and let's get started. You're perhaps still in hospital or you've just left hospital. Let's start with 2 exercises. Now, posture is incredibly important. If you're slumped over, you can't do exercises properly. Stand up or sit up straight, keeping your shoulders level. Now imagine you've got a cord pulling on your spine to keep you up straight. So what we're going to do is flexion and extension. Sit up straight, make sure your spine is straight, and just with your spine straight, gently let your head drop with your chin tucked in. And return to normal. Do this exercise 5 times a day, and each time try and keep it in the stretched position here a little bit longer. Now for flexion, this is tilting backwards. Now keep your mouth closed, but also if you've had surgery on your tongue, it is best to keep your teeth closed with your tongue inside your teeth to avoid biting a flap. Here we go. And return to normal. And once again, if you can keep your head tilted in that extension position a little bit longer each time, you will recover quicker. We're going to look at shoulder exercises, elevation and depression. No, you're not going to get depressed. Remember, if you don't use your body, you'll lose the ability to use your body. So the more you work at this, the sooner you will get back to normal. So, sitting straight, with your arms down beside your side, raise your shoulders up towards your ears. Keep your spine straight and hold it. And lower. Up and lower. Up and lower. Again, try and make sure that your shoulders were in line to start with, and that one shoulder blade is not drooping down below the other. And 5. Again, 5 exercises, 5 times a day. Now depression, pushing down. Imagine you've got very heavy weights in your hands and they're pulling your shoulders down, and then relax. And then we've got the weights again. And relax. Depress and relax. Depress. See if you can hold it a little bit longer. And relax. Again, 5 times a day. And the longer you can keep it in the stretched position, the better it will be. Now, I had my neck dissection this side, so put your arm at right angles to your body and put your hand on your shoulder. And just try and raise the arm. Won't go very far at first, but persevere. Raise and lower. Raise and lower. Raise. Can you hold it? Go on, try. Hold it. And lower. Raise. Hold it that little bit longer. And lower. Now put your arm out to the side and touch your shoulder. And try and raise it. And lower. Raise and lower. Raise, let's hold it a little bit longer, and lower. Raise and lower. Once again, raise your arm, touch your shoulder, back straight, make sure your arm is at right angles to your body, and now open your arm as far as it will go, and hold. Return. Open your arm as far as it will go. Hold, and return. Sometimes you might find you can just do a little movement, but the more you do, the greater the extension you will find. Again, 5 times a day.
Don't rush your exercises. If they become easy, push yourself a little to get a bit more stretch. When doing neck exercises, always make sure your shoulders are level and that you're warm. If you're used to working at a computer, there's a tendency to slouch forward, so keep this in mind. So when do you do these exercises? Well, any time. But if it helps, find triggers, such as when the TV ads are on, or you're sitting in a stationary car, or when you get out of the shower. Set yourself a routine and use whatever works for you.
Let's look at sideways. You might find that one side is easier than the other. Persevere, it will come back. Sometimes it helps to do these exercises in front of a mirror because you can double check whether in fact your shoulders are straight. Because I remember from my operation I came out looking a bit like this, and it was quite an effort to straighten up the shoulders. So keep those shoulders straight and the mirror will help you. Let's look at rotation. Again, posture is so important. Keep your back straight and look as far to the right as possible. And return to neutral. Look to the left as far as possible. And return to neutral. Keep thinking from a posture point of view that you have a string attached to your spine and it's pulling up to keep your spine perfectly straight. Let's go again. To the right and to the left. Neck retraction. Again, sit straight, spine nice and straight, and just push the lower part of your head and your neck backwards and hold. Relax, put it back, hold, relax. Once again, the longer you can keep it in that position, the better it will be. We're now going to do retraction. Basically, we're going to push our shoulder blades together as far as we can.
Sitting up straight, squeeze those shoulder blades together and hold it. Again, squeeze those shoulder blades together, hold it, and relax.
And once again, if you do five times a day, you will find it easier and you will get more extension each time.
Let's review some neck exercises. Always make sure that you stand or sit with good posture and have a glass of water before you start. Some of the review exercises will be a little faster, but you will get there with practice. When you bend your head to the side, try to get your ear as close as possible to your shoulder. As your neck feels a little looser, try a full rotation, but do start slowly. When you've finished your neck routine using bio oil, massage gently. This will help reduce any scarring from a neck dissection and help the stiffness after radiotherapy. Good luck, subscribe below, and look out for future exercises to help your recovery.